If you had one of these substandard plans before the Affordable Care Act became law, and you really liked that plan, you were able to keep it. That's what I said when I was running for office. That was part of the promise we made. But ever since the law was passed, if insurers decided to downgrade or cancel these substandard plans, what we said under the law is you've got to replace them with quality comprehensive coverage. Because that too was a central premise of the Affordable Care Act from the very beginning. And today that promise means that every plan in the marketplace covers a core set of minimum benefits like maternity care and preventive care and mental health care and prescription drug benefits and hospitalization. And they can't use allergies or pregnancy or a sports injury or the fact that you're a woman to charge you more. They can't do that anymore.
On March 23, 2010, President Obama signed the Affordable Care Act. The law puts in place comprehensive health insurance reforms. The goals of Obamacare include introducing new consumer protections, providing all Americans access to health care, and improving the quality and lowering the overall cost of health care.
We spend $3 trillion a year on health care in the United States. And there's a lot of experts that think we could cut that by a third. That would be a huge amount of money. So I think that is something that we're going to have to do, because as the population gets older, as I am in my generation, it's going to be a big burden on all of you unless we can do something about healthcare costs. And many people believe we can cut costs and increase quality. But the problem is right now, the healthcare professionals are paid for doing some things and not others. The incentive is to do those things for which you're paid. Well, the Affordable Care Act, one thing it does is it gives everyone a chance to have health insurance. So right now, if you don't have health insurance and you're in an accident, bad accident, you're taken to the hospital, if you can't pay the bill, the hospital doesn't get reimbursed, and that's why everyone else's insurance is higher. So if everybody is covered, that will save some money.
The Patient Protection and Affordable Care Act of 2010, or Obamacare, creates several new Medicare programs intended to improve healthcare quality, using pay-for-performance payment strategies to put financial pressure on medical providers. In such programs, reimbursement reflects provider performance on metrics based on adherence to certain care processes, scores on patient satisfaction surveys, or patient outcomes. The rationale behind pay-for-performance is the result of a real problem. Payment for medical services, particularly by large government health programs, does not reflect value or benefit for patients. To address this issue, the United States should move towards a genuine market-based payment system, rather than simply perpetuating flawed financial structures.
Insurance is an agreement between the person and the insurance company. And that insurance company will dictate people's care. They'll say, no, you only get 12 visits for this, or 16 visits for that. And that might not be what the person needs. So by not being part of that insurance, I can dictate how much care they need to achieve the goals that they want to in our office. I mean, I think the cost of healthcare is extreme. I mean, I think I just saw somewhere that healthcare is 25% of our GDP. If we invest our money in keeping our health, it's much cheaper than in trying to regain our health. I think a lot of it just stems that insurance companies' job is not to help people stay well. Their job is to make money. They're a profit-driven company. It's just this weird conflict of, okay, they're trying to make money but save money, but they're not necessarily covering things that will save the money and could be healthier for the person at the same time. And I think that's another reason why we just don't get involved with that model. It's because it is not, to me, a ethical model. It's because people should be paying me for what I do, for what they value. But I have to make sure I provide them value so they pay for it, not just know the insurance company's going to pick up some of the bill. And I think that's when you get doctors that just aren't really that good because they can make a living off of insurance, not off of being good at what they do.
What is your opinion about Obamacare?
I think the intention was good. There are certain things that needed to be addressed about healthcare, but they went about it in a completely irresponsible way. For example, as a business owner, they keep changing the rules, changing the qualifications. They changed what constitutes a full-time position. They changed that to 30 hours. And basically, since they keep pushing back employer mandates, employee mandates, it's kind of leaves an uncertain environment for a business owner to make decisions.
What is your opinion of Obamacare?
I think it's not what they are putting it out there to be. If you go under the healthcare.gov, I had an insurance agent from my past help me get it. If you go onto healthcare.gov, the plans that they are showing, and then when I talk to an actual person, the prices are different. The deductibles are ridiculous. Our discount, but the deductibles are so high that the only thing that's really going to be anything good for it is like a major surgery. It's $9,000 for myself and my husband. The insurance is reasonable, but then they throw on that high deductible, and then they throw on your how much you got to pay in before you get a discount on your copay and then your prescriptions, and how are these people that are on a set income? How are they going to afford that and pay their bills and pay for their home and their utilities, and they're being forced to pay for insurance that they cannot afford?
Do you offer your employees health care?
We do not, no.
And is this because of Obamacare?
It's because my husband works for the government and he has really good health care, so
okay.
we don't.
So you expect your employees to get health care from other sources?
Yeah, all of the employees that we have here are part-time. We don't have any full-time employees.
Okay. What is your opinion about the Affordable Care Act?
I think it's good.
Think it's good?
Yeah, I definitely think it's good. I mean, I know a lot of girlfriends that are my age, and some of them have never had health care before until now, and they're finally able to get health care. I think one thing that I've noticed from talking to some of my girlfriends is some of them will make, just above the point where they're able to still get the Obama health care, and it's like within hundreds of dollars. Like, it's not a significant amount, but because they claim everything that they make, they aren't able to get it, which is, I think, still a bummer.
So a lot of people think of Obamacare and the Affordable Care Act as just the health care exchanges, but a lot of it is how we deliver care so that it's better takes care of people and costs less. America spends more on health care than other countries, but we have poorer outcomes in a lot of areas. That doesn't make sense.